What if the long, hard road to recovery after an injury wasn't just about endless, repetitive exercises in a clinic? What if it was about exploring a whole new digital world? Well, today, we're diving into how virtual reality is jumping from the pages of science fiction right into physical therapy. And it's totally changing one of the toughest parts of medicine, rehabilitation.
You know, this quote from Indiana University Health really hits the nail on the head. The biggest hurdle in traditional rehab, so often, it's just keeping patients motivated. This whole new approach tries to fix that by flipping therapy from a chore into an actual experience.
But okay, that brings up the big question, right? Can a virtual world actually create real-world healing? Can playing a game or interacting with a digital space really translate into measurable physical recovery? That's the core issue we're going to unpack in this explainer.
So here's our roadmap. First, we'll look at how VR even became a clinical tool. Then we'll get into the cool science of how it all works. After that, we'll check out the platforms being used right now and explore the huge trend of at-home therapy. And finally, we'll see what the research is telling us about where this is all headed.
All right, let's jump in. Section 1, a new reality for recovery. We are officially past the what-if stage, people. Virtual reality is no longer some futuristic concept. It is being used in clinics today to help patients heal.
So why do we even need a new tool? I mean, think about it. If you've ever had to do the same set of exercises day after day after day, you know how quickly it can turn into a real grind. And study after study shows that when a patient's motivation dips, guess what? So does their progress. And this is exactly where VR swoops in. It turns those repetitive movements into something that's actually engaging. So instead of just lifting your arm 20 times, you're steering a virtual dolphin through the ocean. In fact, one study found that a VR scenario can be just as motivating as having a therapist right there cheering you on. Pretty cool, right?
But look, this isn't just about making therapy more fun. No, there is some serious neuroscience at play here. We're talking about tapping into the brain's incredible, almost magical ability to heal itself.
The key concept, the star of the show, is something called neuroplasticity. The best way to think about it is like a city's road network. Let's say an earthquake happens and some roads get blocked. Neuroplasticity is the brain's power to build new roads and find new routes around the damage. And that's exactly what's needed after an injury like a stroke. VR's engaging exercises are designed to basically pave those new pathways.
Okay, now here's where it gets really fascinating. It's a concept called embodied medicine. See, when you control an avatar in VR, you're firing up your brain's mirror neurons. These are the same neurons that fire when you watch someone else do something. It kind of tricks your brain into thinking you're doing the action yourself, which helps translate what you're doing in the virtual world into real-world recovery.
It's also super important to know that not all VR is the same. In the clinic, you've got two main flavors. First, there's immersive VR, which uses the full headsets for a total sensory experience that's great for upper body and cognitive training. Then you've got non-immersive VR, which is more screen-based. That's used a lot for things like gait, balance, and practicing daily activities.
So we've covered the why and the how. Now let's get into the what. What are the actual tools and platforms that clinicians are firing up in their offices today? One of the biggest names in this space is a company called MindMaze. And they haven't just built a product, they've built a whole ecosystem. It can start with something called the MindPod Dolphin for really intense, immersive therapy right after an injury. From there, a patient might move to MindMotion Go for therapy at home. And the whole time, their Physiolog wearable sensors are collecting objective data so everyone knows exactly how the recovery is going.
Another heavy hitter is XRHealth. Their whole focus is on using AI and what's called extended reality, or XR, to create powerful tools for both patients and their clinicians.
And check this out. One of their coolest innovations is the XR Care Cart. It's basically a plug-and-play VR station on wheels. This is a huge deal because it makes it incredibly easy for a hospital or a clinic to get started with VR therapy without needing a massive, complicated IT setup. You just roll it in and go.
So here's the bottom line, and this is so important. This is not the same as playing a game on a consumer headset. Clinical-grade VR is a totally different beast. It's data-driven, tracking every single movement. It's therapist-led, which means a real clinician is personalizing your care plan. And most important of all, it's evidence-based. We're talking FDA-registered programs that have been through the ringer in actual clinical trials.
Okay, so let's talk about maybe the biggest game changer of all in this space, the massive trend of moving rehab out of the clinic and into the patient's own home.
And we have to be crystal clear about the difference here.
On one side, you have clinician-supervised home rehab. That means a personalized plan, data being monitored by your therapist, and clinically validated software. On the other side, you have consumer apps that are just for gaming or general wellness with zero clinical oversight. They're worlds apart, and it's a really critical distinction. Companies like XRHealth have made this whole process incredibly simple. You just start with an online consultation where a therapist builds your personal care plan. Next, a full VR telehealth kit gets shipped right to your door. Then you just start your therapy, and every single session, all your progress is tracked and monitored remotely by your clinician.
So, we've seen the absolutely incredible potential of this technology. But let's get down to brass tacks. What does the actual research say about the future of all this? Well, a big recent scoping review gives us a really balanced, clear-eyed view. The findings show that yes, VR has a ton of potential, and lots of studies are reporting positive trends in things like motor function and quality of life. But the review also points out that a lot of the existing studies have some limitations. We still need more rigorous, standardized, long-term research to really strengthen the evidence.
But just to give you a sense of the scale here, that one review pulled together the results from 15 different randomized controlled trials, with a grand total of 804 stroke patients. So yeah, the field is still growing and evolving, but it's being built on a really solid foundation of serious clinical research.
Which leaves us with one final, kind of mind-blowing thought. We've seen how this tech can boost motivation, tap into the brain's own ability to heal, and bring therapy right to a patient's front door. So the question you have to ask is, are we looking at a future where the most effective road to recovery doesn't always lead to a clinic, but can actually start right there in your own living room?